Hi guys, my name is Avery DeFazio and the date is the 29th of August, and this is my presentation on Danon disease. Okay, so for this project we created 4 different deliverables where we answered questions and learned about a specific genetic disorder. The disorder that I learned about was called Danon disease. So a little bit of an introduction. So what is Danon disease? It is a rare genetic disorder. It is a lysosomal storage disorder, so it includes the lysosomes. And it actually occurs when there is a mutation in the LAMP2 gene. What is the LAMP2 gene? It stands for lysosomal associated membrane protein 2. And the mutation causes this protein to be defected. The gene where this protein comes from, the sequence is known. The location, based on the name you can tell, is it's located in the membrane of lysosomes. And its role is to mediate the fusion of autophagic molecules, vacuoles. So what that means is basically the LAMP2 protein is in charge of engulfing and getting rid of the damaged cellular material. So you can understand that we want the damaged cellular material to be out of our bodies, and if there is an issue in this, or a mutation in this specific gene and protein, that means that the cellular material that's damaged isn't leaving our bodies, and that creates a multitude of issues. It is a multi-system condition, which means that it doesn't just affect one system of the body, but it affects the heart, skeletal muscles, eyes, and brain. So let's talk about how this is a genetic mutation. So the mutation leads to reduction or absence of functional LAMP2 protein, and that protein is the product of the LAMP2 gene expression. So changes in the DNA sequence of the LAMP2 gene leads to improper function of production and function of LAMP2 protein. So it can basically create improper function or just completely get rid of all function of the LAMP2 protein, which this would be called, this type of mutation is called a loss of function genetic mutation, because 1, it's genetic, and 2, you're losing the function. You're losing the ability for the protein to do its job. Genetic testing is recommended to confirm the specific mutation in the LAMP2 gene. So there's kind of a couple different, it's all one sequence, but there's different parts of that sequence that can be mutated. And that mutation, along with a couple other epigenetic factors, really determine the outcome of the disease and how that mutation will affect your body, what symptoms you'll have, things like that. So the impact on the body. It disrupts the cell's ability to break down and recycle waste, like I said, and thus causes a buildup of damaged cellular waste. And this causes a range of symptoms. They can be asymptomatic, so you don't feel them, you don't even know that you have this disease, all the way to sudden cardiac death, which is very severe. I found it interesting that these symptoms actually differ for male and female because, I'll get into it, but because of the way that it's inherited. And then some of the symptoms that occur are hypertrophic cardiomyopathy, which is basically the heart muscle and it thickens. As you can see on the right, that's what you're looking at here. So there is a normal heart on the left, And then with that same cut, you can see the light pink. And then with the hypertrophic cardiomyopathy, you can see how the muscle really thickens, and this causes that sudden cardiac death because the heart is having to pump, or is having to work so hard to pump blood to the rest of your body. And if it gets too much, then your heart, is overloaded, can't do its job, and thus causes the cardiac death. Another symptom is skeletal myopathy. So similarly, it causes muscle weakness, just like it would cause, the heart to work so hard that it can't do its job anymore. And then the last symptom is mental retardation. But like I said, this differs for male and female, and it differs for what kind of other epigenetic factors play a role in. So I'll get into that later. So the heritability, it is inheritable. It is a genetic mutation on the LAMP2 gene, as I said. It is an X-linked dominant pattern, so you only need one copy. It is sex-linked, and because of the X-linked dominant pattern, it's normally passed from the mother. So, are there any associated risks? Basically, are there severe epigenetic factors that you can avoid? And unfortunately, there's no preventative measures that can be taken. So when a mom finds out that she has this disorder and she has kids or wants to have kids, there's no way for her to prevent herself from passing those on. There's nothing that she can do for herself. There are no known epigenetic factors, although, as I said, the symptoms range from person to person, and so that's why they're kind of unknown. They don't know why male versus female, and then even within the same gender, the factors differ as well. So they just don't know the cause of that. And then there is no evidence for causation of failures in cell cycle checkpoints. This was a topic that we discussed a couple chapters ago about how the cell cycle has checkpoints to avoid mutations, and a lot of mutations occur from failures in those checkpoints. But there's no known evidence that Danon disease comes from one of those missed checkpoints. It's more so a malfunction in the lysosomal degradation pathway instead of the cell cycle checkpoints. So let's say you're diagnosed with, or you have heard about this disease. What do you do about it? So the diagnosis method is genetic testing. It is not something that is done in a regular checkup because it's so rare. It requires a referral. So that referral happens because you either have symptoms of the disease or a family history of the disease. And the only preventative technology is family genetic screening. So the only way to prevent your future generations from having it is to check yourself to make sure that you don't have the gene to pass it on. Supportive care. So this is kind of, there's no, well, I'll get to that, but supportive care. So there's medication, devices, and transplants that can be done to help the symptoms. Supportive care is knowing that you already have the disease, and it's not a cure for the disease, but it's to help with the symptoms that come along with the disease. And then lastly, the gene therapy. So it uses RPA501 and AAV9 LAMP2B. So these were found by, or created by the Rocket Pharmaceuticals, the company. And this gene therapy is in a clinical trial stage. These two different items that I mentioned are basically in charge of, it's using gene therapy. So you're taking cells and you're putting them in a vector and allowing healthy lysosomal cells that are not infected with the mutation come and bind and do the job of what the damaged lysosomal cells cannot do. So they found that it's sustained that protein expression and has led to cardiac improvement on people that have Danon disease. So this is definitely a positive outlook. They are trying to improve the efficiency and the effect of the treatment. So this is good, but it's obviously not perfect. So as you can tell, they're still in the trial stages. So we'll see what happens with that. So in conclusion, I think the most important thing is if you possess the symptoms of Danon disease or it runs in your family, because the symptoms can be asymptomatic. So you should see a doctor right away to get a referral for genetic screening. It is a rare genetic lysosomal storage disorder that is heritable. So again, genetic screening is really important. And the biggest thing to take away is that it's caused by a mutation in the LAMP2 gene, affecting the LAMP2 protein, preventing it from doing its job. And then these are the resources that I used, and 2 more. Thanks.